All right, let's talk about something that can start with a super common problem, an earache, but can turn into something way more serious, and frankly, pretty scary. We're talking about mastoiditis. It's this hidden danger that can sometimes follow an everyday ear infection.
So picture this. You or maybe your kid has a really bad earache, but then you spot something new, this painful red swelling that's actually behind the ear. What in the world is that? Well, that particular sign is a massive red flag, and it's exactly what we're going to break down right now.
The official name for this is mastoiditis, and what it is, really, is a bacterial infection that has escaped the middle ear and has invaded the mastoid bone, and that's the hard part of your skull you can feel just behind your ear. So we're not just talking about an ear infection anymore. This is an infection in the bone in your skull.
And its location is exactly why doctors take this so seriously. I mean, listen to this quote from ENT surgeon Vic Veer. "It's scary because of how close it is to your brain. That bone is like a doorstep to some of the most critical parts of your body, which is why spotting this early is just absolutely crucial."
So, to really get a handle on the risk here, we need to understand the bone itself. What exactly is this mastoid bone? And what makes it so, vulnerable to an infection like this?
Get this, the inside of the mastoid bone isn't solid. It's actually got this spongy, honeycomb-like structure. Think of an Aero chocolate bar, full of all these little air pockets. Now, these little air cells are all connected to your middle ear, which is great for hearing, but it also creates a perfect little highway for bacteria to travel from the ear and set up shop inside the bone.
Okay, so this is the part you really need to file away. What are the warning signs? Knowing what to look for can honestly make all the difference in the world.
So you're looking for more than just a standard earache. We're talking about intense pain behind the ear, with swelling and redness you can actually see and feel. Usually there's a high fever and maybe some discharge coming from the ear. And for parents, if your little one is super irritable, crying constantly, and pulling at their ear, you have to pay attention to that. It's their way of telling you something is really wrong. Now here is a really specific visual clue that doctors look for. Go ahead and feel behind your ear. There's that sharp little crease where the ear connects to your head, right? It's like a V-shaped valley. With mastoiditis, the swelling from the infection actually pushes that crease out, making it soft and rounded, more like a U-shaped valley. Losing that sharp V crease is a classic telltale sign. And to build on that, the swelling does more than just soften the crease. It physically shoves the entire ear forward and out. So the ear on that side will literally look like it's sticking out more than the other one. If you look in the mirror and one ear looks outstanding or just different, that is a major, major warning signal.
So how in the world does a common run-of-the-mill ear infection make that leap into becoming a dangerous bone infection? Well, the path is surprisingly direct.
Here's the thing. Mastoiditis almost never just appears on its own. It's pretty much always a complication. It happens when a middle ear infection either isn't treated or isn't treated fully. The bacteria just pack their bags and move from the middle ear right into those little honeycomb air cells in the mastoid bone that we were just talking about.
And the usual suspects, the bacteria causing all this trouble, are typically these guys. Streptococcus pneumonia is a big one, which, by the way, is why getting a pneumococcal vaccine can actually lower the risk. Knowing which bacteria are the likely culprits helps doctors choose the right heavy-duty antibiotics to knock this infection out.
Once inside the bone, the infection starts on this really destructive path. First, fluid and pus get trapped in all those little air cells, and they have nowhere to go. The pressure starts to build and build, so much so that it can cut off the blood supply and cause the delicate bone tissue itself to actually die and break down. This creates a larger pocket of infection, an abscess, and that is the real crisis point, because from there, the infection can break out of the bone and spread. So, you've spotted the signs, you've gone to the emergency room. What happens next? Well, the medical response is usually very fast and very systematic.
A doctor can often make a pretty strong diagnosis just based on the physical signs we've covered. But to know for sure what's going on, they'll order a CT scan. That's really the gold standard. It allows them to literally see inside the bone, confirm there's an infection in that honeycomb structure, and figure out exactly how far it's spread.
And this number is so important. 48 hours. Doctors have this number in their heads. If a patient is put on powerful IV antibiotics and doesn't get significantly better after 48 hours, that's when they start thinking very seriously about surgery.
So once mastoiditis is confirmed, treatment is immediate. The patient gets admitted to the hospital, period, and they're started on intravenous antibiotics right away. This is not a take some pills at home and see kind of situation. The infection is way too serious and needs a direct, powerful assault.
Now, if those antibiotics aren't winning the battle, surgery becomes the next step. It might be something relatively simple, like making a tiny cut in the eardrum to let the pus drain out, but in the really bad cases, a full-on mastoidectomy is needed. That's where a surgeon has to go in and physically scrape out all the infected tissue and diseased bone.
Okay, let's bring it all home. Let's talk about recovery, how to prevent this from ever happening, and why being so vigilant is the best way to make sure things turn out okay.
Really, the biggest takeaway for prevention is just this: treat every single ear infection seriously. That means if you're given antibiotics, you take all of them, and you go back for a follow-up to make sure the infection is totally gone. That, plus staying up to date on vaccines, is your best defense against an earache ever turning into something like this. And the reason for all this urgency, all this caution, is to avoid these potential complications. I know they're rare, but if this infection is left to run wild, it can cause permanent hearing loss, it can paralyze the nerves in your face, create abscesses in your brain, or even lead to life-threatening meningitis.
But, and this is the most important message, despite how scary all that sounds, if mastoiditis is caught and treated quickly, the outcome is excellent. The vast majority of people, kids included, make a complete recovery with zero long-term problems. The key word in all of this is prompt.
Which brings us to the final, bottom-line piece of advice, put perfectly by Dr. Veer. If you see those signs, the swelling behind the ear, the redness, that ear sticking out, the lost crease, this is not a time to wait and see. This is when you go to the emergency department straight away.
So we'll leave you with this. It is so easy to write off an earache as just, a part of life. And 99% of the time, that's all it is. But knowing what to watch for, knowing what that next level of danger looks like, that is powerful knowledge. Thanks for joining us on The Explainer.